from all the continents. Let me start by introducing you to our panelists first. We have Megan O'Donnell. Megan, you can raise your hand, who is an Assistant Director of Gender Program and a Senior Policy Analyst at the Center for Global Development, Washington, D.C. We have Justice Martha Koome, who is a judge in the Court of Appeal of Kenya and a chair of the NCAJ Special Task Force on Children Matters. We also have Dr. Changu Mannathoko from Botswana, who is the country managing partner of Joint Minds Consult. And finally, we have Ms. Berhan Taye, who is a senior policy analyst at Access Now, and she leads a global campaign on Keep It On. It's called the Keep It On campaign. I also have here with me in the virtual space the Jaslika team, who are moderating the questions on YouTube, live stream, Facebook, and Twitter. They are Jasmine, Conrad, Ernest, Wangui, and Naum. You won't see them, but they're working from behind the scenes. And they're joining in from different parts of Kenya. And we also have a technical team supporting us from Nyeri County in Kenya, that is Ali and Karoro from Yokohama, Japan. And I'm Sheila Wamahiu. I'll be your facilitator today, and I have a co-facilitator with me. That is Declan, who is there. You may not see him, but Declan is my co-facilitator. Declan, can you take us through the ground rules before we start the presentations?
Thank you very much. Hello to everyone. Welcome to this fantastic webinar on GBV, in times of crisis. We have a few guidelines to help us manage, engagement within this webinar. So the first really critical guideline is please refrain from making comments that do not relate to the topic or to what is being discussed by the panelists. Second critical webinar is that the chats can also be used to ask technical questions. For example, if you're having issues with the sound, please feel free to ask about it in the chat. You can also direct your technical questions to hello@jaslika.com. hello@jaslika.com. If the problem can realistically be resolved during the course of the webinar, then our team will do what they can to resolve it. Thirdly, you can still write in your questions. You can write in your questions throughout presentations. Your questions will be compiled and passed on to the speakers at question time. Fourth, Jaslika is guided by the values of respect and diversity. Any inappropriate comments will not be tolerated at all. If you make an inappropriate comment, you will immediately be removed from the chat by our team of moderators. Inappropriate comments include, but are not limited to, personal insults, comments that are tribalist, racist, sexist, homophobic, transphobic, ageist, or ableist. We really hope that none of this will come up. Lastly, we are reminded that we are being recorded, so just be aware. Thank you very much, Doc. Back to you. Your mic is off.
Thank you, Declan. So let us get started. Today we are going to talk about, we have a very distinguished panelist, as you've heard, who will be talking about different aspects, different dimensions of gender-based violence in situations of crisis. And first on our panel will be Megan O'Donnell, who is who, as I've said earlier, works with the Center for Global Development. She works on issues related to women's economic empowerment and financial inclusion, gender data and measurement, and development effectiveness. Prior to working at the Center for Global Development, Megan worked at the One Campaign, which is an international advocacy organization that focused on sub-Saharan Africa, where she led the development of One's gender and inclusive growth-focused policy, recommendations to donors and country governments. Before joining One, she coordinated the Center for Global Development's Gender Research Program and has also worked with Inter-American Development Bank, the International Center for Research on Women, CARE USA, Banyan Global, and the Middle East Institute. She has a master's degree in Middle Eastern Studies from the University of Oxford and a bachelor's degree in politics and French from the University of Virginia. Today, Megan will share with us some key findings focusing on impact from a recent research study that she co-authored on pandemics and violence against women and girls. Megan, over to you. Huh?
Okay to start? Okay, thank you so much, Sheila, Declan, Jaslika, for organizing this interesting and very important conversation and for allowing me to participate and share some of our recent research. As many of you all are likely seeing in the news every day, we are seeing increased reports of gender-based violence, violence against women, girls, other children, rise in light of the COVID-19 pandemic. But of course, it is difficult in real time to get comprehensive data to inform response efforts and make sure that they're going to be evidence-based and as effective as possible. So to try to fill that gap, myself and a number of different co-authors working through the Center for Global Development sought to look backwards, to go historically into past pandemic contexts and also circumstances of humanitarian and other crisis contexts where circumstances may be similar, to try to identify and trace the different pathways through which gender-based violence would increase, right? What are some of the circumstances in those crisis contexts that would lead to incidents of increased violence? We mapped out 9 pathways total. I'm not going to go through all of those during this short presentation, but if of interest, after I highlight a few of them, you can find our working paper and a blog post that summarizes it on CGD's website. For now, I'll just highlight a few that are top of mind and what we see to be maybe the most at risk. The first relates to increased violence due to economic insecurity. So right now, in light of COVID-19 and also in these past crisis, pandemic, and humanitarian contexts I referenced, we see lost livelihoods, we see reductions in income, and we see that circumstance falling disproportionately on already vulnerable or poor populations. We know that from past evidence, this leads not only to completely understandable increased stress, poverty-related stress, and tension within households. There's also compelling evidence to suggest that this leads to poor coping strategies by individuals. And by that, I mean things like increased substance abuse. There was really good research done a few years ago by the Soul City Institute down in South Africa that traced increased use of alcohol with increased incidence in domestic violence. So not entirely surprising to folks who work on these issues, but where I sit here in the United States, they have categorized liquor stores as essential businesses that have stayed open. So sort of sheds light on and is somewhat concerning for those of us who know that there is this correlation, this relationship between increased substance abuse in light of poverty-related stress, and then increased violence. The second is, of course, tied to quarantining, social isolation, and social distancing measures that have been imposed in light of COVID-19. So pretty straightforward that when you see families and household members spending more time together, especially again under these stressful circumstances, the likelihood of violence is going to increase. In this context, we drew upon research from other humanitarian settings, so for internally displaced persons, for refugee communities, where there has been quite a lot of research done on increased domestic and intimate partner violence in light of that stress, that containment, that sort of social isolation from other community members, local populations that these folks may have left behind. Of course, in addition to just the increased time spent together under stressful circumstances, quarantining and social isolation is leading to limited access to, as I mentioned, social networks, friends and family who may otherwise serve as sort of that frontline protection, ensuring that violence is handled and is eliminated. And also more formal sort of public sector response services. So healthcare workers who are now facing strains because of folks going in light of diagnoses, are not there to respond as quickly to women and children who would otherwise go to these responders as a first or at least a second resort, as well as legal systems. We're seeing a lot of legal systems postpone hearings. You know, we'll be hearing from a judge later who is far more expert than me on this issue, but in terms of what the research is telling us, we're seeing some delays, you know, at least speaking to the context I know best here in the US, of even really important hearings related to child custody, temporary restraining orders, legal separation, things of that nature. Another pathway we see relates to exploitative relationships and the fact that in times of humanitarian crisis and pandemic specifically, we're likely to see different pathways where transactional, coerced sex increases, especially among young and vulnerable, poor demographics of adolescent girls. One of these pathways, specifically in looking at the evidence on the Ebola outbreak, is related to school closures, where we saw that because of economic duress and because of time out of school, sort of the removal from that safe haven environment, adolescent girls were much more likely to start to spend time with older men. Families were pressuring those girls to engage in transactional, obviously coerced sex in exchange for food, transport, vaccines, basic healthcare, things like that. And we saw, therefore, an increase, a sizable increase in teen pregnancy and the inability of a lot of these girls to return to school. So we see immediate effects in terms of violence in that context, but obviously longer term consequences as well. A second pathway for exploitative relationships is directly with aid workers, where we've seen evidence of those who, in a position of power with something to offer, again, like basic food, healthcare, vaccines, or transport, are using that position of power to incentivize or to coerce transactional sex. The final pathway I'll touch on before turning to some of our policy recommendations and what we can do to address these issues is an increase in violence against healthcare workers themselves. So in light of a pandemic, but really under business as usual circumstances as well, women are on the front lines as essential workers, making up nearly 70% of the global health workforce. And under normal circumstances, we already see that women in the health workforce are likely to face issues of harassment, sexual, verbal, or otherwise, by some of the patients and folks who come to see them in healthcare facilities. Under heightened stress, under healthcare system strain, we predict that this is even more likely in light of COVID and other pandemic contexts. So with all of that in mind, what is there to be done? How do we address these issues? Drawing upon the research and the evidence base that we reviewed, I'll highlight 4. And again, there are other things that can be done that the working paper lays out for you. The first is the need to consider violence, both in rapid response and in long-term preparedness efforts. So the same way right now, we are all mobilizing to make sure that folks have personal protective equipment, ventilators, masks, things of that nature. We know, based on the evidence, that gender-based violence, violence writ large, is likely to increase. This has to be a part of government's subnational, national, and otherwise rapid response efforts as a priority. Just a couple of weeks ago, we saw the UN Secretary General come out in a call to action and a recognition of how important this issue is as a crisis. About 140 countries signed on to a statement affirming his statement and recognizing this as a priority. But of course, it's an entirely different story whether beyond signing that statement, country governments are going to mobilize the resources that are necessary to address these issues. And we argue that that is necessary. The second pathway for improvement concerns economic relief. So remember, as I cited, poverty-related stress having a lot to do with increased tensions and violence in households. We've got to think about social protection measures, including direct cash transfers that just alleviate some of the economic strain that vulnerable households are facing, that decrease the likelihood that women and girls will have to engage in transactional coerced sex as a result. And one of the ways to do that is to ensure that women especially are targeted through these cash transfer and other social protection programs so that that is alleviated. The third recommendation is around social networks. As I mentioned, this is oftentimes where women and children feel most comfortable turning in light of the perpetration of violence. And of course, that's difficult under social distancing measures, but to the extent possible, where technology platforms are available over WhatsApp, over Facebook, over some of these other communication services, fostering networks that can still be there to support one another and to maintain those channels of communication. We hosted a webinar a couple of weeks ago where we had Buki Williams, who is the CEO of a Nigerian nonprofit, Education as a Vaccine, come and speak from her vantage point, doing a lot of the service delivery right now in Nigeria. And she mentioned where WhatsApp isn't available, where mobile phone ownership may be lower, using radio to make sure that there are basic messages around support services, resources, where folks can go if they are victims of violence. The final one that I'll end on in terms of a recommendation and then turn back to Sheila is around the need for flexibility of funding from donor organizations right now. Obviously, donors are mobilizing quickly to try to prioritize the healthcare side of the COVID crisis. But to the extent donors are already supporting civil society organizations focused on women's rights, focused on gender-based violence, a recognition that these are essential frontline services as well, and the need to allow these folks with their on-the-ground expertise to move as rapidly and as flexibly as possible to do what they know they need to do in their communities to address these issues of violence and support survivors. So with that, again, thank you so much for allowing me to participate and share our new research. I'll pass it back to Sheila.
Thank you so much, Megan. That was really interesting. Megan was talking about the research that they've done on pandemics and its impact on violence against women and children. And I don't want to summarize what she has said because there was so much in it. But maybe I will just say that apart from the findings, she's made some very critical policy recommendations, which that includes prioritizing gender-based violence by national governments and the international community as being very critical in the fight against the pandemic, because the long and short-term and long-term impacts of pandemics. And we must recognize that. So even if the pandemic ends tomorrow, the impact will remain for a long time to come. And she's taken us through other economic, raised attention to the importance of targeting women and girls for targeted cash transfers, making sure that they don't have to engage in transactional sex, coerced sex, to we mitigate some of the conditions, the risks that they confront during times of not only pandemic, but also other types of conflict. And also the need for flexible funding and recognizing women-focused organizations, those fighting against GBV and women's rights as frontline workers. So Megan, I have a question for you. And this question has come in from Irene from the University of Cape Town. And she's asking, well, she has read your paper, but she's asking, did you get a sense of, like, the structural violence that is, you have it, which is reflected even in decision-making processes, like on testing, who should be tested, who should be provided by the PPEs. So do you know whether they have any gendered impacts? Like in the UK and Italy, they took a decision not to prioritize the aged, the old people and the disabled. So did your research find anything to that effect?
Thank you. And thank you so much, Irene, for that question. It's an excellent one. And it is one of the pathways that I did not highlight, but I'm so glad that you've raised and have an interest in. I think that your question reflects, a really critical component of any conversation we have on gender-based violence and on broader gender inequality, which of course is intersectionality, and the fact that we know that women and men are not just these homogenous groups, but of course we need to be looking at other demographic characteristics like age, like migrant status, like race and ethnicity, to understand who are sort of the most at risk and the most vulnerable for some of these issues. Yes, one of the pathways that we traced was virus-specific violence. And of course, there's a lot to unpack there. Your question already alluded to one of the examples of it, where we are prioritizing sort of the importance of the life and safety of some populations over others, that those are choices being made by our healthcare systems that in a more prepared context would not have to be made. That in and of itself is a form of violence and discrimination. There's other things to be unpacked in terms of who is more vulnerable to this disease. Its relationship to toxic masculinity as a social driver of the fact that men are right now more likely to die of this disease. Of course, there's some research coming out that conveys that some of that may be biological, and the fact that women's immune systems, sort of genetically speaking, are a little bit stronger just biologically. But it doesn't help that men are much more likely to engage in those poor coping strategies that I referenced earlier in terms of substance abuse, especially smoking, that leads to hypertension and increased risk of respiratory issues, where we see this disease then compounded by other health risks. So the need to look at the work of organizations like Promundo to think about how we change this toxic masculinity, convey that men are just as in need of quality healthcare and self-care, so that isn't sort of a form of structural violence, if you want to convey it that way. And then the final dimension before I end in addressing this question is, of course, that the virus itself can be used as a form of violence. And we're a bit concerned that especially perpetrators of abuse and violence under sort of business as usual circumstances, unfortunately now have another tool in their toolbox where folks can contract this disease and then spread it. And so much in the way that we saw, sexual partners of those having HIV being more likely to contract that disease, this can be used as sort of a tool of violence itself. And the need to recognize that in our response efforts will be required.
Thank you very much for that, Megan. I think that's a very powerful statement that you've made, that this virus can be used as a tool of violence, and we must be aware of that. And whatever we do, raising awareness in our programming, in our response, we must take that into consideration, because as you've pointed out, this happened with HIV. It happens in war, in conflict. It's used as a weapon of war. So thank you very much for that. We'll come back to you later during Q&A again. That was really a very interesting presentation. Thank you. So now I'd like to turn to Justice Martha Koome. And Justice Koome, some of you may already know her, but those especially in not only Kenya, but in the region. She has been a role model. She has been an icon for many, many years. She has over 32 years experience in the legal sector as a practicing attorney before she joined the judiciary as a judge of the High Court and the Court of Appeal. At the Court of Appeal, she currently heads the criminal division of the court. She holds an LLB degree from the University of Nairobi, a postgraduate diploma in law from the Kenya School of Law, and an LLM in public international law from the University of London. Judge Koome started her legal career pretty young in 1987, where she successfully founded Martha Koome and Company Advocates, which was one of the very few women-led law firms at the time. This is in 1993 in Kenya. While in private practice, she distinguished herself as a defender of human rights, specializing on family law and taking up high-impact litigation geared towards the development of law on the principles of equality and non-discrimination on the basis of one's gender. Apart from family law, she also represented clients such as political detainees. And I do remember that at that time she was very young. She, together with another Kenyan icon, two women who defended one of the political detainees when many of the men were not, male lawyers were not ready to come forward to do that, because it was really dangerous at that time. So she represented clients as political detainees and persons charged with politically instigated offenses during the volatile period of one-party rule in Kenya. She contributed directly to the expansion of the democratic space in Kenya in the 1990s. Judge Koome successfully represented women in precedent-setting cases in the Court of Appeal, which used to be the top court in Kenya then, on women's property rights, and was one of the leading lawyers in family law. She was the chairperson of the Federation of Kenya Women Lawyers, which is FIDA, and part of the team involved in the drafting of the Children's Act in 2001, the National Gender and Equality Commission Act 2011, the Equality Bill and Domestic Violence Bill, which became the Protection Against Domestic Violence Act in 2015, among others. She served in the Council of Law Society, becoming the first treasurer of the East Africa Law Society, and was elected by the African Heads of State Summit in 2005 in Libya to serve in the African Union Committee on the Rights and Welfare of Children, where she served for 5 years. She has made an impact in whatever position she has held. She was an elected chairperson of the Kenya Judges and Magistrates Association and appointed more recently by the Chief Justice of Kenya on behalf of the National Council for the Administration of Justice, which is NCAJ, as chairperson of the Special Task Force on Children Matters. This was a multi-sector task force which has just concluded a comprehensive review of child law, policy, rules of procedures and practice directions, infrastructure of child holding, coordination and training of actors in the juvenile justice. And the task force has prepared a report that was launched on 20th November 2019 in commemoration of the 30 years since the UN Convention on Children. And this report you can actually find even on the Jaslika website, as well as the NCAJ website. Judge, over to you.
Thank you, Sheila. That was a very generous introduction. And thank you also, Jaslika. Is my mic and everything on? Thank you. Thank you for inviting me to share this platform with such excellent panelists. And I'm very, very humbled and very, very privileged even to listen to Megan. Very, very deep conversation on gender-based violence during the crisis. I will take a small trajectory and focus on children because I think that is now my docket at this moment. I am dealing with issues of children and say that this pandemic has affected children more than anybody else. Not in terms of the sickness itself, because I think somehow God has been gracious. He has spared the children from the disease itself, but the implications, the effects have really affected children because first and foremost, children are not in school. In Kenya, we are battling with many, many issues of children. First of all, getting our girls to school. And when they go to school, retaining them. We are battling with early pregnancies. And now when the girls are not in school, and Megan alluded to this issue of, you know, in school, they access many things. They get food, and they even get sanitary towels. Now, the poverty levels are such that when they are at home, they are not likely to get these items. And therefore, they are likely to be ruined to, you know, compromise and be exploited, you know, sex for sanitary towels, sex for, you know, things like those. So it is a big problem that has been identified even here. Violence against children as well, because the same factors that Megan has spoken about, domestic violence, when children are at home and they are within the confines of a situation where there is violence, they also get affected. Recently, there was a meeting of the National Council on the Administration of Justice in Kenya to evaluate the situation of crime in this country. And it came out that 41% there is a spike in the increase of cases of violence against children and defilement cases, girls who have been defiled, children who have been defiled. They noted there was an increase of 41%. That was 2 weeks ago. And like Megan noted that there is a problem of access to justice because courts are not functioning optimally, such that if somebody is facing domestic violence at home and the victims, the higher percentage of victims will be women and children, and they have to run to court to get a restraining order, that is becoming a challenge because, first of all, you leaving home to go to court is a problem. And when you reach the court, getting the priority of appearing before a judge or a magistrate to obtain an order is a problem. and also the execution of the order, because there is a kind of a freeze that restraining orders may become problematic, because the other side will say, look, I also want to go to court and be heard. And then the police also are not prioritizing this as the problem, because they have been mobilized to deal with the pandemic. So there is a problem of access to justice, but I had, and we also had a meeting of the task force together with other stakeholders through this forum. And we agreed that cases of violence against children and domestic violence should be taken seriously at the police stations. And we were urging the National Council for the Administration of Justice to come up with a statement to say that domestic violence or any violence of any kind is unacceptable this particular time, to ensure that the communities, the families, take the responsibility of protecting and safeguarding their children against violence. And the fact that violence is happening now when children are supposed to be in a place where they are supposed to be safe. Children are at home. They are with their communities. One would imagine this is the safest place and safest environment for a child to be. But that is not the case. The cases of violence against children have escalated. So who is to blame? And we asked the National Council on the Administration of Justice to visit responsibility on the families and the communities. We have a kind of a structure in Kenya of managing, families or communities called
It looks like we lost Justice Martha Koome.
Sorry, guys, those of you who are watching, it looks like the internet connection to Judge Koome has dropped. We'll try and get her back. So we will continue with her when she comes back. But maybe in the meantime, we can move on to the next speaker, because she has touched on some issues that our next speaker, who is Dr. Changu Mannathoko, will be touching on. So Changu, maybe we can move ahead with you. I will quickly run through to introduce you, because Changu, sorry, it looks like Judge is back. Should we go back to her? Judge, okay.
Yes. So we gave recommendations and resolutions that should be passed by the National Council on the Administration of Justice, that priority should be given to cases involving children, because these are not the only problems that children are encountering. There are children also in the justice system who have been caught up in this melee. And if you're talking about children in the institutions of justice, they have been locked there in such that they cannot leave. And even if more children are rescued and need protection, especially those who have been rescued from violence homes or environment, and they need to be put in a safe place. Those institutions are not opening up to children from outside because they are saying they are fearing contamination. So we also urged that there should be a midway house, a quarantine place where children can be held for the time being for protection, because there are many children who have been rescued from violent situations, but they are hanging with some unknown people. Maybe police are told, go back with them, so we don't know where those children are. So moving forward, the biggest challenge we have is access to justice. And because now what is being offered is online services, and the majority of our people cannot access, digitalized a way of serving documents or filing documents or having a webinar meeting so that they can conduct their cases. So these are the challenges we are coming across to mitigate the violence that is being visited on the families and children. Thank you.
For that very comprehensive presentation and based on what is actually happening on the ground in the child justice system. It's like Megan had said earlier, there are consequences that are short-term and long-term, and some consequences that we do not even anticipate. Like what the example you gave of children who are being rescued now, and the existing institutions don't even want to take them on. Now, there's one question maybe related to that you haven't touched on, that is children with disabilities. What is the situation of children with disabilities now? Because are there any kind of support that you were able to provide, or even identification of these children, because they're very much at risk?
Yes, a very critical question at this moment, because children with disabilities are likely to be forgotten. One, because obviously children are vulnerable, they don't speak for themselves. What I have gathered is that the cash transfer that is being mobilized by the government towards mitigating the suffering brought about by the pandemic is targeting households with persons with disability. And the chiefs have been told to go around and document the cases, the households that have children with disability, so that they can benefit from the cash transfer. But these are children who need more than just the cash transfers right now. There are children with the physical disability, there are children with mental disability, and there's a lot of tension this particular time. Their life has become destabilized. They are living in very volatile environments where there is tension and there is stress. They are not even understanding when life will be normal again, especially children who go to institutions every day for their support, or their schools or wherever they go, and they are no longer going there. They are suffering a lot of stress. And what we noted is that there is no psychosocial support or mechanisms being put in place to address, these issues. Everybody is targeting the bigger picture of the pandemic. But the kind of mobilization that we have seen to deal with the COVID as a pandemic, I submit that this is the kind of mobilization of efforts that should be put together to fight gender-based violence and violence against children. I believe if we prioritized fight against violence the same way we have targeted COVID, it would be the thing of the past. If we went to the press, in the media, to talk about violence against children, violence, gender-based violence, the same way we are talking about COVID, I believe it can be eliminated, at least a good percentage of it.
Thank you so much. Thank you very much, Judge. I think that's again another very powerful end to her presentation, where she's saying that if we put in all the efforts that we're putting into fighting COVID-19, and it's been declared a pandemic, and if we did the same, also declared GBV, violence against women and violence against children, a pandemic, maybe we would go much further than we have today. So thank you for that. And over to Changu. I will just introduce Changu briefly. So Changu has a very long and rich career as a senior officer at UNICEF. She's a researcher and academic and is well known for her advocacy and commitment to the promotion of girls and of girls' empowerment in and through education. She was a senior education policy advisor at UNICEF New York and represented UNICEF in global consultations and many international fora on many different dimensions of education, including overseas life skills and HIV/AIDS and girls' education and so on. She was UNICEF Regional Education Advisor as well for the Eastern and Southern Africa region between 2001 and 2006, and has worked as senior consultant in various organizations like Commonwealth Secretariat, UNDP, UNFPA, and others, and the government of Botswana as consultant. Between 1986 to 2000, she was director of the Gender and Development in Southern Africa course at the University of Botswana, which was launched in 1996 and was implemented in many SADC member states. Changu has conducted research and published in the areas of teacher education, education management, gender education, girls' education, and social studies, life skills education, HIV/AIDS in education, and child-friendly schools and quality education, as well as out-of-school children. For example, she coordinated and edited an operational research under UNICEF SRO, which was conducted in 7 countries in this region between 2002 and 2003 on gender, sexuality, HIV/AIDS in education. Changu, I remember meeting Changu for the first time when she was chair of NSA, which is a regional research network, this is early 90s, that coordinated and supported the country chapters to conduct pioneering research on the education of the girl child in the early 1990s. Over to you, Changu.
Thank you so much, Sheila. I am really honored by Sheila and Jaslika for inviting me to this very important engagement. And I am also really happy to have been put as the third person to speak because what Megan and Justice Koome have done is to lay the groundwork for me, because it's very important when you are looking at education and girls' empowerment in emergency situations to look at it within the context of structural issues within the whole society. whether it's the political structure, economic structure, whether it's the health structure. So all these are intertwined. Education is linked together with them. So I think that type of overview, which has been provided by the first two speakers, Megan and Justice Koome, has really helped in the focus which I'm going to provide on education and girls' empowerment in emergency situations, with a focus on gender-based violence. One of the important things which I want to highlight is that in emergency context, the vulnerability of girls and boys in and around schools is heightened for those of them living with disabilities, like it has just been mentioned by Justice Koome, and also those who are in institutions of care, like those who are actually in reform centers or in prisons, and those living in extreme poverty, living in child-headed households as one of the impacts of the HIV/AIDS pandemic, and those households headed by females, and other households which are headed by grandparents in sub-Saharan Africa. So you find that we also have got girls and boys who are on the move as migrants, as refugees, as asylum seekers, and as internally displaced people. So all these are girls and boys living in situations of emergency. So we need to provide that broad understanding to be able to see how we situate COVID-19. I also don't want to downplay girls and boys living with HIV as we are speaking now, because what UNAIDS has also made very clear is that in some of the countries, even in my own country, the number of girls who are being infected is also going up and up. And one of the reasons why is because of gender-based violence, which is also a huge problem throughout our region. So we also need to keep in mind that when you think about gender-based violence, we're also looking at those girls and boys who are facing discrimination due to gender identity, sexual orientation, and also due to the lockdown during COVID-19. So now looking at all these issues, so looking at the risk factors linked to violence in and around schools, one needs to really emphasize issues of inequality. One needs to emphasize issues of social norms and patriarchy, and because those are the ones which create this negative masculinity, which impacts on the lives of girls. So we find that we have harmful gender norms that become even more entrenched in situations of emergency, and also in situations of the pandemic which we are in right now. And these are situations where you will find that in emergency situations, girls are confronted with sexual abuse. They are confronted not just with sexual abuse, but psychological abuse. And this psychological abuse can happen within the school environment. It can happen in centers of learning, in refugee camps. And this psychological abuse can also happen in the home. So that that is extremely important to keep in mind, that when we are talking about gender-based violence, we are looking at issues of bullying, we are looking at issues of social abuse, we are looking at physical abuse, and with boys who suffer much more from, for instance, corporal punishment in schools than girls, whereas some of the research has shown that girls are really impacted a lot by psychosocial abuse in schools because of gender stereotypes, especially when it comes to certain subject areas. And so this also heightens the fact that when we are looking at how to mitigate and how to end gender-based violence, I want to highlight the importance of research and data in this area. And that is why I really appreciate the research which Megan has done. However, when it comes to education, we still have a long way to go in having adequate research on issues of education in emergency situations that can inform policy and practice in schools and in education systems. So what is the way forward in terms of emergency preparedness, rapid response, and how to address these issues? So one of the important challenges, which I was very happy has been highlighted by the Justice, is issues linked to legislation and policy frameworks. That we really have serious fault lines which prevent laws and policies on school-related gender-based violence from being effective and from being implemented. And sometimes the reason why they're ineffective is because some of these policies, we don't do enough research, so that the type of interventions put in place do not really ensure that these policies are effective on the ground. A very good example is issues which in schools are faced by girls, like defilement, like pregnancy, sexual abuse. You find that there will be a law saying, like in Uganda, that defilement applies when girls are below 18 years. But then when you go to implementation, you will find that the law will apply to low-income men who have defiled, but middle-income, high-income men, politicians, who are, some of them can be teachers, you find that the law in terms of enforcement does not apply to them. And these are some of the challenges that in emergency situations, how do we ensure that strategic planning to address these issues ensure that there is equality when it comes to enforcement? So you find that a lot of these policies on linked to gender-based violence, the action plans are very weak if they're available. Resources to ensure that the implementation takes place is limited. And teachers, you find that some of the research which has been done in Africa by UNAIDS, done by UNESCO, UNICEF, has shown that a lot of teachers are very eager to learn how to address gender-based violence in the schools, but they don't have the training and they don't have the mindset to address this, because these teachers are coming from societies where gender-based violence is increasing from day to day and is actually escalating during this period of time. So basically, in terms of the way forward, we really need national education plans, strategies to incorporate policies, procedures, governance, curricula, pedagogy that involve all stakeholders in the school, preparing stakeholders to understand these policies and even to develop new policies, these stakeholders, be they parents, be they NGOs, be they the girls themselves and the boys themselves. And so that they're part and parcel of the response. Some of the research which has been done, do I have a bit more time?
I think maybe 30 seconds.
Okay. Some of the research which has been done has shown that when it comes to sexual abuse and bullying and gender stereotypes, when you bring girls together and work with NGOs which have expertise, these girls are able to get empowered. Working with teachers to strengthen teachers' confidence to address school-related gender-based violence, engaging communities in whole school approaches to gender-based violence. Whole school approaches, like ensuring that schools are centers of safety. And these whole school approaches have been tried in conflict situations, like in Uganda, like in Mozambique, where there is a good school kit, where the whole school community, including the young people themselves, get an understanding of rights and respect within the school communities. I would like to say, I'll end by saying that linked to the pandemic, but also linked to the overall understanding of education in emergencies, you find that in all our countries, it's in a situation of lockdown. Some of the schools in our countries, the teachers have provided textbooks so that children can continue learning. And some of that learning requires a systematic approach with teachers being able to monitor. But a lot of the schools have not been able to ensure that when the lockdown came in, there is a connection between the teachers and these kids, especially because a lot of our countries, we don't have broadband. In Botswana, only about 46% of the population has broadband. So you find that it's only elite schools where you find that these children at home are learning through open and distance learning, and they still are linked with the teachers. But the majority of these children are not learning because we have not scaled up apps which can be used, whether it's on cell phones, whether they can be used on TV, on computers, so that children can continue learning. Even maximizing on the use of the radio has not really been capitalized on. And one of my suggestions is the role of the private-public partnerships in providing funding and technical expertise when it comes to this whole area. So I think I would like to finish by saying that it is very important that when we are looking at schools and in situations of education of emergency, we really have a whole structural approach where we involve economic, social, and education and health legal expertise so that we address the whole system. You cannot address education on itself. You have to link it with other sectors. Let me stop there. Thank you.
Thank you so much, Changu. I know there's so much to say and share. I think I will pick up on two things from what you said. The whole issue of taking a whole school approach, multi-sectoral approach, bringing in other sectors, which I think is running through the other presentations implicitly or explicitly, but also the gap, enforcement gap, which is very important. And thirdly, this is where I would like to take over the presentation to Berhan, and after that we can answer questions together, is where you're talking about the digital divide. Yes, we have technology which is helping some children, but is it actually increasing the inequity between those who have and those who don't have? So yes, ICT is a great thing. And I think Changu will bring you back later in the general discussion so that Berhan can actually try and answer this question through her presentation. But I think it's a very important point that you've raised. Thank you for that. So Berhan, if I may introduce Berhan Taye, who has, through her work at Access Now's Keep It On campaign, raises awareness and defends the digital rights of users, especially those most at risk, which includes women and girls. The global campaign aims at stopping internet shutdowns is a coalition of more than 150 member organizations from across the world. She also engages in policy work on issues relating to prevention of internet shutdown in the continent and beyond. Berhan is a researcher whose work has spanned countries of sub-Saharan Africa, Ethiopia, Kenya, Senegal, South Africa, for some examples. In her research, she explores the relationship between emerging technologies such as AI and drones and how they affect social justice. She has done considerable research on gender and the impact of technologies on women and gender equality. This has involved looking at how GBV happens online and how technology can be harnessed to mitigate its impacts. Before joining Access Now, she was a researcher for the Technology for Social Justice Field Scan project, where she investigated the tech and social justice space in the US. Before that, she was a Ford Mozilla Open Web Fellow with Research Action Design and Open Technology Institute. Berhan previously worked with the Alliance for Affordable Internet, researching the gender digital divide in Kenya, and at the IGAD's Conflict Early Warning and Early Response Center, mitigating violent conflict in East Africa. She has also conducted research on transitional justice and criminal violence at the University of Notre Dame and engaged legislative processes related to land rights in Cape Town, South Africa. Berhan holds an MA in Peace Studies and Public Policy from the University of Notre Dame and a BA in International Relations from Malmo University. Over to you, Berhan.
Thank you, Sheila, and good afternoon, everyone. It is afternoon in Nairobi, Kenya. Thank you for the invitation, and the esteemed colleagues that were talking about many of the important things, and the research that you all are doing is quite impressive. So I want to take this conversation a bit to the online space and talk about online gender-based violence and what that means in this conversation. So some of the research, for instance, that has been done by Association for Progressive Communication and policy based out of Uganda, for instance, says that 30% of women that they've surveyed have experienced some form of online gender-based violence. So what that means is, cyber stalking, revenge porn, publishing of people's naked or nude pictures without their consent, trolling and harassment online is quite prevalent for many of the women that are connected to the internet. That is their daily experience of the internet. So for instance, out of those people that are also surveyed, for instance, 95% say they don't know any legislation that can help protect them from this, or if somebody's nude pictures are leaked online, they don't know that they can go to the police and report that. In many other contexts, actually, what we know is that it's the victims that are actually prosecuted for for the things that are happening to them online. And what makes this, I think, online gender-based violence a bit different from many of the things that we've been talking about today is that, at least for instance in Ethiopia, 90% of the victims of online gender-based violence say they don't know who the perpetrators are. So that's a very different angle. So now when we're talking about COVID and everybody being stuck at home, the lockdown, children's not being able to go to school, it doesn't mean that the gender-based violence that we're seeing is only confined to the home space, right? Like, so people are online, a lot more people are working from home, so there's definitely an extension of that violence also happening in the online space. And then when we're looking at the cybersecurity space, we've received many reports from across the world. A lot of cybersecurity experts are talking about the insecurity of the cyberspace right now, whether it's end-to-end encrypted platforms not necessarily being end-to-end encrypted, or people being targeted, phishing attacks. There's an increase in the insecurity of the cyberspace. So women are, of course, disproportionately going to be affected by that. So what are the online gender-based violence that we're seeing? We know that women don't have the necessary digital security trainings, and they're more prone to be hacked. They're more prone to be targeted just because of the nature of technology and the fact that it perpetuates what exists in the offline space. So one thing that we've seen, for instance, here in Kenya is that in the COVID conversation, a person that was diagnosed with COVID-19 and was published and was a bit known to the public, for instance, their nude pictures were leaked online. So that is, you'd assume this sort of things would not happen at this time, but the perpetrators of gender-based violence are also online working, doing that. So that's one case that we've seen, for instance, to be a problem. Legislations still are not really strong enough to protect women from all of the things that are happening. So then when we shift this conversation to understanding, yes, technology is really important at this time, because all of us sitting out of our homes are able to have this conversation and to dialogue, to be able to work from home because we have access to technology, because we have access to the internet. But the downfall of that is that when all of these online gender-based violence that we're seeing are being perpetuated online, what are the platforms and the technologies that are facilitating and aiding and abating this violence to continue to happen in the online space? And of course, as always, the platforms, social media platforms especially, are really critical in the conversation of online gender-based violence. And one of the things that we've seen is with the issues of content moderation. So what we mean with content moderation or content governance is, when you post something on Facebook, Twitter, or other platforms, how is that content governed? How is it taken down? So we know there's been a lot of conversation about how, for instance, Facebook and Twitter are moderating content right now, and how content might not necessarily be taken down because a lot of the content moderators that are working from home, or it will be the artificial intelligence that will be taking down content. So when we're seeing more revenge porn being posted online, when we're seeing more nudes and other non-consensual content being posted online, who is actually moderating this? How is that being taken down? Women are still going to be disproportionately affected. And of course, a lot of the issues that we're seeing is in closed platforms where they're either end-to-end encrypted in Telegram and WhatsApp, where people don't even know where to report those things. So those are some of the issues that we're seeing. And of course, it's technology can also be a solution in this space, right? And Megan and others have touched on a bit about this. Is the social cohesion that we have, the support groups that we could potentially, tap into as women are facing online and offline gender-based violence. So different apps that, if you go from all the way from Australia to Brazil to Tunisia, have been tried in this time and even previously before COVID. So these are supposed to be platforms where, people can gather, can, figure out information about like where do we report gender-based violence that we're experiencing at home and outside the home as well. So we've seen chatbots, hotlines, online support groups to be quite useful in this time. And of course, one thing that's really important to note here, and the judge has also alluded to this, is access to justice in times of pandemic is a crisis, right? Like, so for instance, we know in Ethiopia, all courts are closed except a few that are supposed to deal with gender-based violence and domestic violence that are arising at this time. But, as it has been previously alluded as well, the unfortunate thing is that not everybody's connected, at the same level. So one of the issues that we're seeing, of course, it's always, in this conversation, it's always structural. right? Like, so rural areas are completely forgotten when it comes to internet connection. If they have a good broadband internet, it would be quite a surprise. While most of us sitting in Nairobi are even struggling with our internet bandwidth, let alone folks that are based out of rural areas. And of course, those are the ones that are going to be most missed. So any technology suggestions, any legal empowerment, or even virtual courtrooms that we're talking about won't be accessible to the majority of the women that might most need them at this time. So that's one really important thing to note. And of course, technology cannot be cannot replace human beings, cannot replace any of the courtrooms, any of the things that we see, and should never be a suggestion. And this is definitely not, but it can definitely aid in creating that space that we've lost in terms of being able to to confide in your friends, being able to confide in your teachers. That should definitely be provided in the online space. But one thing, of course, to note and very important is we've seen the rise of hate speech. We've seen the rise of misinformation and disinformation online right now, where it's become extremely difficult to dissect between the fact and what's not fact in this time. So women are also disproportionately going to be affected by that. And we've talked about policies that are when we're talking about making sure that technology somehow fills this gap, we need to talk about what is the privacy data protection policies that are put in place. If you're going to a chat room and sharing that information, is that information going to be processed in any way? How is that information going to be shared with other parties? Those are really important things that need to be considered when we're rolling out these things. And one last thing that I want to point out is the issue of the digital divide. The digital divide is really clear. It really is visible. So internet service providers and governments play a really significant role here, where whether it's putting in unnecessary barriers for people to connect. So for instance, in Uganda, we know if you want to use social media platforms, you have to pay $0.05 per day. Which might not seem a lot, but for folks that are trying to use at least that WhatsApp group that they have, for women that are in the informal sector selling shea butter or whatever that they're selling on those platforms, is still a barrier to connect, and it's still a barrier to access that information. So there are many barriers that people have that really inhibit them from joining the digital space and from really gaining access to all of these things that are being shared. So those are some of the issues that we're seeing right now, and we're expecting to see more online gender-based violence escalate as COVID also escalates. Over to you, Sheila.
Thank you so much, Berhan, for that. I think what Berhan has done is she's been able to link the offline gender-based violence and to the online gender-based violence. In this kind of a situation, it's both have escalated on and offline, and also addressed the technology as a challenge, as a barrier to women's empowerment, but also that it can be a solution in some instances. It is a solution to that. But at the end of the day, what Berhan has told us is technology can never replace the human being. So while we can harness technology to help us, and despite the digital divide, those are issues, weak enforcement, problems with moderating online content and reporting, some lack of awareness. Despite all that, at the end of the day, we know the human being is still very important. And especially now in this time of social isolation, which is really physical isolation, because we can still be social without being in touch with one another. I'll go straight to the questions now that has been coming in from participants. And maybe I'll start with the number of questions on technology and data. So let me start with that. There's a question from, let me see, from Achola Rosario from Nairobi, who is asking, the most important component for help is changing the mindset of each household. Are there any plans for radio, TV, social media programs and infomercials? I don't know whether you're in a position to answer that question, but Berhan or anybody else who can respond to that.
Well, I can touch on the aspect of access to information being extremely important at this time, right? Like the one way that we can all protect ourselves, our loved ones, is by accessing really credible information. And what has been a challenge now is the troves of misinformation and disinformation, and of all of the cures apparently that whether presidents are suggesting or people are suggesting and passing on information about like really fake cures for COVID or all of those things. So the fact that governments should be providing and other healthcare professionals should be providing accurate and accessible information. And one thing that's really important is it can't just be on WhatsApp, because a lot of people that majority of the population that is not connected to the internet doesn't have WhatsApp or doesn't necessarily have the money to pay for WhatsApp specifically as well. So using radio, and I think Megan was also talking about radio being used in the Nigerian context. I think that's really important, making sure that we get to the people with whatever platforms that are most available to them. There shouldn't be a barrier to access to information. So that's one thing that I would say on that.
Sheila, maybe I can also say something about information. I think this is a time of crisis when people have come together for the common good of the society. And it has already been identified that the next biggest challenge that we have close to this COVID is gender-based violence, which is cutting across children, people with disability, the elderly, and everybody is suffering some form of violence one way or the other. The question Chola asked whether there could be programs through the radio or TV to educate people to change their mindset about, being, respectful to one another, avoiding violence. This is a message that should go clear to the policymakers about messages that say violence within the domestic violence, violence within homes, intolerance of one another is unacceptable. I think if this message can find its way now to be mainstreamed within the COVID disaster management strategies that have been put in place, it can work, and we should explore that.
Thank you, Judge. She has given us an area that we can actually move forward and explore further, but there's a question related to that from Linda Bonio, and she's asking, is it possible to have quick policy responses rather than hope that technologies will fill this infodemic? So I think that question can go to, I think that question can still go to Berhan and maybe the judge, or Megan, I don't know. Oh, Changu, you want to answer that? Please go ahead.
Yeah, I wanted to link my response in terms of quick policy responses, also to the response on changing mindsets, because that is what education should be about. And this changing mindset is not just linked to health, it's also linked to social norms and gender stereotypes which endanger the mutual respect. So what I really would say is that in education and in the mass media, also through campaigns, we should really push the type of courses which we already have but can be sharpened, which are focusing on emotional intelligence, on changing minds, and on human rights, and also programs and training which encourage girls and boys, men and women to interact and live together as friends with mutual respect. And also for men and boys to see gender-based violence as also their problem, not the problem of women, and for women and girls to also communicate. So I think at a policy level, mass campaigns using radio and all other mass media should also be linked to what is happening in the education sector and what is happening in raising money, private-public partnership funds to make all these things to happen. So it should be really kind of simultaneous action with all stakeholders involved.
Thank you, Changu. I'll just ask the questions, and whoever wants to jump in can jump in and respond to those questions. There's a question from Charles Cado, who is from the education fraternity, and he's asking, how could the cultural beliefs and myths that evolve around the pandemics but considered gender-based violence be handled? Any successes to benchmark with? So anybody wants to jump in? Megan?
I'm happy to start here and then, turn to others. I mean, I think this question is somewhat linked to the one that Berhan just addressed about changing sort of social norms within the household and communities through these platforms. And I feel like in addition to, not being able to agree more with what she said about conveying accurate, scientific, evidence-based information, there's opportunities for sort of role model effects in a sense, especially to younger populations, adolescents who are still learning how to engage with the opposite sex, with their peers, with their families in healthy, kind of productive and safe ways. So the two studies that stick out in my mind, one comes from Eliana La Ferreira and a group of researchers that looked at telenovelas, just soap operas in Brazil. And a pretty cool study that I think we could build on and model elsewhere, that showed that women's preferences for what they wanted to do in terms of getting pregnant, how many children they wanted to have, what kind of sexual relationships they wanted to have, and how healthy and equal those were changed because there were these role models just delivered to them through the TV for how women were more empowered within their households and their romantic relationships. Another example that's more practical, to my knowledge, it hasn't been rigorously evaluated yet, but gets a lot of attention, and rightfully so, is on the continent, MTV Shuga, which again sort of targets teen populations and talks about healthy relationships, healthy sex, education, and advancement sort of within the workforce. So these are models that I think we can be looking to in COVID and much more broadly, obviously.
Thank you for that, Megan. Anybody else want to respond to this question? Or we can, I think the other questions that are related, so let's ask the other questions and then you can come in. So we have a question from Juliet Root. Juliet is asking, my concern is on children in abusive situations within the family. Which community networks protect the children or report the cases on their behalf, especially during crisis? So this is, I think, Juliet Nyambura who's asking this question. Anybody want to go?
Wow. I think this is a difficult question, which was alluded to earlier in the presentation, I think, by Megan, that during this difficult time, families are isolated because of, social distancing. So the lockdown means that a lot of abuse can go unreported. There has been a lot of work meant to empower children to become agents of themselves so that they can be able to report cases of violence against themselves. But in this situation now, who do they report to? They are probably victims of violence by the caregivers who are supposed to be taking care of them. They have no access to telephones so that they can probably call, an auntie or a relative or a social worker, or even the 911 number. So this is a real practical problem, Juliet, that is at the moment that children are probably, many children are locked in very abusive situations. Even when they are rescued, the problem is compounded further. As I said, many of the government institutions are also on lockdown. They are not accepting people who are coming from outside because they want to protect those who are inside from any kind of contamination coming from outside. And we were actually told when the children who have been rescued are taken to those institutions, they are being turned away. And they are depending on the mercy of child charitable institutions to take them. And also very few charitable institutions are willing to take these kinds of children. And that is why we recommended that there should be some kind of quarantine house, one of the institutions be prepared for this kind of cases so that they can be rescued and put there. But even the rescue effort itself is challenged at this minute. I guess more education so that children can learn how to report these cases for themselves. Because I don't think that social workers are around to go to homes and make visits because of the lockdown.
A related question that is asked by Sam Mukudi from Nyeri, Kenya, and he's asking, what considerations are given to children when pushing parents to quarantine and to jail over COVID-19? What happens to them?
These now become children in need of care and protection. If a parent has been pushed to the quarantine, the people pushing that parent to the quarantine should immediately report to the children officer, a social worker, that there are children in need of care and protection, so that those children can be put under the care of a guardian, or the government can take responsibility of taking care of those children, taking them maybe to an institution. And this is why there has been a huge outcry about the indiscriminate arrest of rowdy people who are contravening the regulations and taking them to quarantine centers without caring whether they are nursing mothers who have babies, whether they have children. I think that debate is arrived in Kenya, but in all cases involving children, their best interest should be taken care of, and mechanisms should be put in place if somebody has young children. One of the things they should consider is this person should be quarantined within a place where the children will not be stressed, where they can be assured that the person is going to be okay, and they're also going to be okay. So I think there are social workers working with the COVID-19 emergency teams for the support of the children. But this is a very, very important question raised about children.
Dr. Sheila, your mic
Yes,
is off.
I've got it. Sorry. I was saying there's a question from Sam of the African Institute of Children's Studies, and he's asking, are there models of what works in responding to gender-based violence at community level, considering that social workers are in many countries not frontline workers? Is there anybody who can answer that question?
Yes, and I'm sure my other colleagues can also provide examples. I think this gives me an opportunity to talk about schools as safety zones and also centers of learning. So we have examples in places like Swaziland, Mozambique, Kenya, where you find that NGOs with UN agencies and government, they don't just make the school a place for learning, but they make sure that there is water and sanitation, that there is school feeding, and that issues of psychosocial support by bringing social workers are addressed in school. And those children from child-headed households or who are orphans, who are in school, social welfare should be aware of them. And then there's also like Childline in places like Botswana, South Africa, or Swaziland, where the young people, especially girls, can pick up a phone and report abuse. So those type of initiatives have been shown to work. The challenge is how to scale them so that they are in more communities. You'll find that they're only maybe in a city or in a small village, but how do you scale them so that more of these young people can benefit from those type of initiatives?
Changu, let's move on to the next question. And there's a question from Botswana, though anybody can answer it. And this is Godisang Mukodi, who's asking, the University of Botswana has a sexual harassment policy which is not being implemented. How can alliances between staff and student gender activists make a difference? And you can answer it, but anybody else is also free to answer that. Maybe Megan.
Yeah.
If something.
Sure, I can start and then try to turn to others. I mean, I feel like sexual harassment policies have come to the fore where I sit in the US and also more broadly and more globally through the Me Too movement. So lots of conversations around social activism and community organizing by having this issue finally, within the workplace, especially including universities and for students where that is their work, shed light on sexual harassment in those contexts. So I think one of the things is to ensure we keep broader momentum apace while all eyes are on this global health crisis. I think there is a huge risk that issues like climate change, issues like gender equality and sexual harassment that we're starting to gain some traction are now going to be detracted from or take a step back because all eyes are on the health space. So I think it will be a very interesting question for all of us who work on these issues day to day, to ensure that we're not only considering the gender dimensions and the gender-based violence specific dimensions of COVID, but how do we keep up the progress more broadly? I don't have any particularly innovative insights on that front, but I think worth emphasizing that this is an issue that, as Judge Koome was emphasizing, that predated and needs to continue to be emphasized even more so going forward.
Thank you. I need to ask, there are lots of questions coming in. And I would like to request that the audience and the panelists give us another 10 minutes or so we can get through more questions. That's okay with the panelists? Thank you so much. Changu, did you want to respond to that, or could I move on to another question so that we have a variety of questions?
No, continue.
Okay, thank you. So we have a question from Dr. Jaya Nair from Perth, Australia, stroke India. And she's asking, what is the significance of women community groups who can support each other, and through those groups, education, technical and legal support can be provided to women and children in crisis? Who wants to go with that one?
Sheila, can you hear me?
Yes, I can hear you.
Okay.
Yes.
You know, women community groups actually in Eastern and Southern Africa, they're really doing fantastic work when it comes to gender-based violence. And but they do need a lot of support, because those of us who work with NGOs, we are very much aware that the funding and support for NGOs has really been going down over the last 10 years. For instance, here in Botswana, in South Africa, women NGOs have established that since the lockdown for the last 3 weeks to a month, the cases of gender-based violence have doubled. In some instances, more than doubled in some of the countries. And so there has been a demand, even from governments, for these organizations to support. Like here in Botswana, we've got this organization which made a huge outcry for support through the social media, through the radio, and got a safe house. They got a safe house for those women and children who needed a safe house. But then the issue is, when there is a lockdown, how do you provide food, utensils, and all that? So there has been that type of a call, but there's also a challenge. How do you get those things? And then government also has to work with this type of women's groups. And some of these women's groups do fantastic research, but it's short term. We need to find ways of providing funds for them to work with university to have much more long-term research, which can really help us to trace the impact and also to address the type of appropriate interventions.
Thank you, Changu. To quickly move on to question, going back to technology and data. This is from Conrad, who is asking, in the light of the current situation of COVID-19, how has technology been used so far in obtaining relevant information to act on?
I can take that. So that's definitely a very broad question, but I would, I guess I'll more or less focus it on contact tracing apps and some of the tools that governments and civil society organizations have been using. So we've seen whether here in Kenya, trying to not necessarily do contact tracing, but rather for public service vehicles, asking them to install apps that would technically monitor who comes onto public vehicles. Or in South Korea and other places, we've seen governments use contact tracing apps to actually monitor who has been in contact and to isolate people. The other ways that we've seen here as well in Kenya and other places is how governments have been using mobile surveillance to actually see if those in quarantine are breaking out of quarantine, or are those that have been told to self-isolate have been self-isolating. So in some ways it has been useful, but some of the things that we as a digital rights organization have seen is the misuse of that information, the lack of consent, the lack of data privacy and protections that are supposed to be put in place, and the sharing. We've seen also the surveillance companies like the NSO group in Israel, for instance, being asked to come in and assist with these things, while these companies have been implicated in many human rights violations. We've also have seen companies, telecom companies, for instance, readily sharing data with government. So some of the things that we're worried about here at this juncture is really rolling back some of the privacy issues and the privacy violations that are happening currently within many countries, whether you look at South Africa or other places. So yes, technology has been used and it's good, and we should put privacy measures in place and go ahead with using some of these things that governments are using, but that protection should definitely be put in place. Data protection commissioners should be engaged, and the third party or public-private partnership should be really stringent so that they don't violate people's right. And it's also, health data is also extremely sensitive, and really so how that information is being shared is also really critical. So we've had that engagement of technology is really good, but we haven't really asked the right questions as civil society or as governments to these companies. We're now have seen Apple and Google are going to be launching their own apps that are going to help governments monitor individuals. So what does that mean when we're talking about fundamental human rights, privacy of individuals? So these are some of the questions that we're asking. And as always, this always affects folks that are marginalized, vulnerable, like women, when compared to other part of the population.
Thank you, Berhan. We have a question from Dr. Alice Umariba, who is asking, what are the salient features learned from this, and what can be done in future to reduce risks for girls in times of crisis? Maybe we can give one or two features, given that we're running short of time. So whoever wants to take this on, Berhan or anybody else? Oh, okay.
Go ahead, Justice, you start.
Oh, okay. No, it's you. I want to hear from you first.
Okay, thank you. Very quickly, there's one program that comes to mind that we saw a lot of promising results from. It's the Empowerment and Livelihoods for Adolescents program out of Sierra Leone that happened to be implemented and then rigorously evaluated during the Ebola outbreak. And it showed, consistent with some of the research that Changu and others have referenced, that these safe spaces for girls especially make a huge difference. So it is this multifaceted sort of holistic approach, making sure that girls have one another and peer and sort of mentor advisors as support networks. They're able to spend their time in productive ways, gaining skills, undertaking productive activities that will eventually lead to livelihoods, income generation. So there is this sort of useful way of spending time, as opposed to being in the context I referenced where transactional coerced sex, more time spent with older men is present. So that's one program to turn to as an example.
Judge?
Yes, I think I was going to speak about almost the same, that when we are dealing with a crisis, it is important to mainstream programs that are targeting like child protection within the crisis, gender-based violence as a category, so that as we deal with the crisis, there is an aspect of the programs or systems that have been put in place that addresses the unique problems of gender-based violence, especially looking at children, women, persons with disability, so that their problems are also taken into account. That's what I would say, that this time we just dealing with the crisis, COVID, and nothing more. So we need now to learn that there are these categories, groups, vulnerable groups that need special attention and special programs targeted to their protection.
Thank you, Judge. We'll just take one or two more questions because before we conclude. And so we have Dr. Purity Thiga, who's asking, how does one address the challenge of denial of access to the target population in educational institutions to collect research data on GBV because of denial and stigma?
Thank you for that. Yes, thank you for that important question. So denial of access, it also depends on where the access has been denied. My assumption is that it's been denied maybe at the community level, but when somebody is going to collect the actual data. But it's not really a question of denial, but it's because issues which are so private and sensitive as sexual-based violence, you find that the survivor is definitely does not want to make it public. And that is why the methods of collecting data have to really be gender responsive, and they have to be ethical, so that the person who is a survivor can be sure that that confidentiality will be kept, because what you are looking for when you're researching is data. You are not looking to actually showcase an individual. You are looking for data so that you make use of that data to generalize in terms of what type of interventions are more appropriate, or what interventions are working. So I think it is the responsibility of the researcher to ensure that the person who is a survivor and is being researched on has the trust and confidence in the researcher. And then that is why in some situations, when you are conducting research, it's secretive with that one individual. In other situations, you have a peer group of girls, and then they speak freely, and then one of them or two of them who is abused will come up with the reality as it is without identifying an individual. So there are a variety of ways of ensuring that you get the data without exposing a vulnerable survivor of violence.
Thank you, Changu. Two final questions, and then we'll stop the webinar. So we have a question from Eunice Y from Virginia, USA. And she's asking, are there any suggestions on how to deal with COVID-19 cabin fever affecting everybody? Anybody want to respond to that? Okay, I think this judge, or maybe
That's medical, it's not legal.
That's anybody, Megan? Maybe Megan wants to say
It's
something.
really not my area of professional expertise, but just speaking sort of person, you know, for the recognition that I think many of us are in this together, you know, healthy communication to kind of tie it back to the heightened risk of GBV and tensions within households. There are, for those who are fortunate enough to have access to technological platforms, lots of discussions being hosted and convened right now by therapists and by social workers who talk about how to have discussions, difficult and otherwise, in productive, sort of healthy, calm ways. And then, yeah, physical activity and sleep to the extent possible as well.
Thank you. For the very final question, sorry, Changu, you wanted to say something?
No, I think that's fine.
Okay. So to the final question, because, there are many more questions coming in, and I guess we have to stop some time. So the very final question that we'll ask now, but remember, we will continue with this discussion. The questions that you've given us, we will be responding to them, but maybe not right now. So the final one that I'm taking in order of the order that we've received is from Karanja, and this is I think more like a policy recommendation. Can we implement a public register of all sexual offenders, especially those who target children, as a preventative social protection measure? I think that's a legal question.
Yes, I think I can answer that, Sheila, and say that in Kenya, we have the Sexual Offences Act, and there's a provision that we maintain a sexual offenders register. Everybody who has been convicted of a sexual offense act is in that register. The problem is that it is kept by the registrar of the judiciary. I don't think it's a public document where you can go to our website and access it. Some work is being done around it to improve on the data within that public register, to make sure that all cases, because we are not even sure that all the offenders have been captured in that register. So there's a cleanup exercise going on, and some rules and regulations on how it can be accessed. They have not yet been finalized. There's a committee working on it. But there is a register like that. And I believe in many countries, they have a register of dangerous sexual offenders who should be captured and known wherever they go.
Thank you, Judge. There's so many other questions coming in, but we really must end the session now. But the questions that we have not asked right now, I think the conversation we will continue with this conversation offline. And for those whose questions we have not been able to take on today, we are going to share with the panelists, and we shall compile them and put all the questions and answers up on our Jaslika blog. So I think with that, I would really like to thank everybody, the panelists, for honoring our invitation and having the patience to be here for so long. We have gone over the time that we had expected, but you have been here very patiently. And the same thing with the audience. I think we've had a tremendous audience we've exceeded our expectations. So it's really been great for me personally. We would be administering a brief survey to all the registered attendees. And we really would value your feedback, as well as feedback from the panelists, because we want to see whether we can continue with these webinars. There's so many important critical issues that have come up that we could have future webinars on, or other forum, engage people in other fora, both policy and for practice. And I think, I think it's been a great day. I don't know, Declan, whether you would like to say something, just final word? Well, before Declan, whether the panelists would like to say a final 20-second response to wind up what they can say. Declan, maybe you hold the panelists first. Just 20 seconds to say something. Changu.
It's myself, Sheila.
Yes. Go ahead.
Okay. Yes, I wanted to amplify the whole issue of policy, that a lot of our governments in the region, they have policies linked to gender-based violence. They have code of conduct for schools, the protocols like sexual harassment in universities. However, the challenge is enforcement. And one of the reasons why enforcement is a challenge is because there is a backlash to the push for gender equality. In the first 10 years of from 2010, there was a lot of activity throughout Africa on sexual harassment policies, protocols, but now there's kind of like a backlash. So we need to address that backlash so that all stakeholders can really begin to unite together to push the agenda forward. Even the SDGs on on gender equality has not really helped to increase the momentum like we should. So this is one area which is a gap. We need to discuss further, maybe in another webinar, and also to see different continents, countries, what are they doing to address this backlash?
Thank you, Changu. So policy gap and what can we do to address the backlash? We are taking one step forward, two backward. Judge, it looks like you want to add something. Make your final statement.
I think my final punch is that gender-based violence rears its most ugliest hand during crisis, according to our experience here. I think what needs to go out is that it is unacceptable. It is still a crime. It should be reported, and there should be follow-up services. And even if the judicial services are remitted, priority right now should be given to gender-based violence. Whichever remitted courts are open, their priority should be gender-based violence, that they should be able to follow through. The other punchline is that now access to technology has become a way of life. You cannot file your documents unless you file them online. Children cannot access reading materials unless they have some kind of internet connectivity. What I would urge is if there are donors who can come in and extend that broadband access so that children, even in private public schools, can also access learning during this particular time of crisis, because we don't know for how long it's going to be. Thank you.
Thank you. Who wants to come in next? Megan, and maybe then Berhan after that.
Sure. As the judge has said, gender-based violence is magnified in times of crisis. I think I'd end by just complimenting that and saying, as we've discussed, it is its own crisis. Before COVID-19 swept the globe, 1 in 3 women already experienced physical or sexual violence in her lifetime. Almost half of female homicides are committed by intimate partners. So if we are all fortunate enough, if and when, to get back to our lives as they once were, out of quarantine and social distancing circumstances, the hope is that this issue has been brought to light more so than it ever has been, and we can't go back to business as usual. This has to stay as a key public health and a human rights priority. And just thank you to all of you for letting me participate. I've learned so much from my fellow speakers. Thank you all.
Thank you. So it can't be business as usual. Berhan.
Yes, so I want my last words to focus more on the offline space. So thinking about like sex workers that are currently not able to work in the space and are not able to feed their families, thinking about all of the women that are trying to access safe abortion at this time and are unable just because of everything that's happening around them, and the human rights defenders and the activists that are trying to still hold on to some of the democracy that is still left even within this COVID situation and the governments that are over legislating, overusing this pandemic to really, aggressively chip away our democracies are all the things that we should definitely think about. And it should be a call for all of us to be very vigilant at this time, because our adversaries are equally vigilant on their end. Yeah.
Thank you, Berhan. We need to be all vigilant because our adversaries are also very vigilant on on the negative things that they can do. So thank you very much, Berhan. Over to you, Declan.
Thank you very much, Dr. Sheila. I think from me, it's just as co-moderator, I was pretty much quiet in the background, but doing one or two arrangements. Firstly, thank the moderator for doing a great job, main moderator, and also every speaker, Justice Koome, Berhan, Changu, and Megan, for such deep insights. There are extensive questions that have been asked that we could not answer in this session. We definitely, number one, the recording of this webinar will be available. And then the other bit is we'll do a publication, whether a blog or whatever, to address these questions and also to continue the discussion. I think my key takeaway is that COVID-19 is not the only pandemic. Sexual and gender-based violence and violence against children is actually a pandemic that COVID-19 is just revealing. So continual discussions like these, and I think it's a webinar series, so it's not the first and the last. Others will come, and other initiatives should actually come up to try and actually highlight this pandemic and find a way to stop it. Thank you very much.
Thank you very much. I don't want to add anything to the wonderful summary that Declan has done, and he has pointed us towards the future, the way forward. So once again, thank you very much to the panelists and to the wonderful audience who are still with us and those who were here before in the earlier part of the day. And hope to see you all soon. Thank you.
Thank you. Thank you, everybody.
Thank you.
Nice meeting you. Yeah, take care.
Same
Be
here.
safe.
Take care.
Yeah.
Yeah,
Be safe.
Bye.
Be safe. So, the cut us off. Oh, okay. So it looks like we are still there. Martha has not left. I can